Good morning again, everybody. Welcome back. You know, when you think of February, you might think of Valentine's Day. There's a running theme there. We're talking about hearts. It's also American Heart Month, so a very good time to think about your heart and its health. So joining me to do exactly that is Dr. Robert Malkin. He's from the Hartford Country Medical Association. Good morning to you, Doctor.
Thank you for having me.
We want to have a little lesson here. We want to learn what we need to know to keep our hearts healthy. You've brought in a model, so we're going to be looking at that as we talk. But first of all, talk to us about coronary heart disease.
Well, coronary heart disease, the scope of coronary heart disease is quite large. Average males at the age of 40 have about a 40 to 50% risk of developing coronary heart disease during their lifetime. And for women age 40, it's about 30% or so.
That's quite high.
Absolutely.
Now, this has been in the past the #1 killer. Is it still?
1 out of every 5 deaths, 20% of all deaths within the United States are still due to coronary heart disease.
Help us understand the heart here by looking at the model.
Well, this is a model of the heart as it is, and then this is a model of the blood vessels, the coronary arteries.
Okay.
The coronary arteries feed blood to the whole heart,
Yeah.
And they're distributed both in the front and the back of the heart. But inside the vessels themselves, as you can see from this model here, we're demonstrating the deposition of plaque or atherosclerotic plaque.
And is that plaque the white there?
Correct.
Okay,
And
so that's a problem.
Lipid deposits, which are enhanced or by risk factors, the common risk factors that a lot of us are aware of, but it's probably worth, it's a good time for us to revisit that.
Let's talk about the risk factors, because I think a lot of people, you know, certainly have encountered problems with their hearts, and they think, come on, I thought I was doing everything right. But one thing they may not know is there can be a genetic predisposition, can't there, to this sort of thing?
Absolutely. There are some modifiable risk factors and some that are not. Age certainly is a major risk factor,
Sure.
and you can't change that.
Right.
Neither can you can't change your genetics or your family history. However, there are a lot of other habits, tobacco, cholesterol, and the different types of cholesterol that we can modify. You can also eat healthy, dietary things, exercise. All those things contribute to heart disease, and there are things that individuals can do, patients can do, to prevent heart disease, its onset, both primary prevention, and those patients who already have heart disease, what we refer to as secondary prevention, to prevent future events.
Now, let me ask you this. You know, if people are hearing this and they think, you know what, I probably haven't done that great a job, is it too late to turn it around? Can you reverse the effects of maybe some bad living and what it's left behind?
Never too late.
Never too late. That's
Never too late.
encouraging. Okay.
At any age. And I think a lot of the studies bear out that healthy living, healthy diet, exercise, regular exercise, at any age reduces the risk of heart disease always.
Well,
up
and
to
we
about
don't want you to
30%.
just hear this and think, oh, I've heard the diet and exercise thing before. It can save lives, it can prolong lives, it can certainly make your life a whole lot better, so really worth looking into.
Absolutely.
And we want to send folks to your website in case they want to get some more information on this. Again, it's a good month to do it because it is the American Heart Month. Go check out his website. It's hcma.org. Again, that's Dr. Robert Malkin from the Hartford Country Medical Association. Thank you so much for being here. I think we had a really great, you know, Heart Lesson 101.
Thank you very much.
All right. And we're back right after this.